my name is Megan Chinnock, and the social problem that I'm going to discuss today is elder abuse. This pervasive issue impacts the age group of late adulthood, which spans from ages 65 until death. For some definitions and statistics, this means age 60 and on, but this is largely a late adulthood issue. So let's talk about the general nature of the problem of elder abuse. The World Health Organization defines elder abuse as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. Elder abuse takes many forms, including physical, sexual, psychological, and emotional abuse, financial and material abuse, abandonment, neglect, and serious loss of dignity and respect. Elder abuse is unfortunately a common issue, and we don't even know the full scope of this problem because it is extremely underreported. Based on a 2017 study of 28 countries of varying economic status, 15.7% of people aged 60 years and older were subjected to some form of abuse. According to the Fresno County Grand Jury report in 2019, it is estimated that 1 in 10 people over the age of 60 or older are abused, neglected, or financially abused. And experts believe that for every one reported case, up to 23.5 cases go unreported. So elder abuse is a much larger issue than we even know. And there are a few reasons why older adults do not report elder abuse. It can be fear of retaliation, loss of independence, having to live in a facility, shame, not seeing it as abuse, or trying to protect a family member if a family member is abusing them. There are several risk factors that make older adults more vulnerable to elder abuse, as well as factors that predispose individuals to be elder abusers. The Fresno County Grand Jury report notes that elders 75 years and older, frail or physically disabled, socially or physically isolated, or who have dementia are at especially high risk for being abuse victims. And then the World Health Organization details a plethora of individual, relationship, community, and institutional factors that contribute to increased risk of being an abuser. And one of the most notable was in the relationship category. An abuser's dependency on the older person, often financial, increases the risk of abuse. And a long history of poor family relationships can worsen as a result of stress when the older person becomes more care dependent. So victims of elder abuse suffer a lot of unfortunate consequences. The CDC divides these into physical and psychological consequences. Physical consequences including wounds, injuries, persistent pain and soreness, nutrition and hydration issues, sleep disturbances, and a few others, but the most notable being increased risk for premature death. And then psychologically, it's been well proven that elders can face high levels of distress and depression. Research is being done on post-traumatic stress disorder and development of anxiety related to being abused. So now let's talk about the local context of this issue in Fresno County. The Long-Term Care Ombudsman program serving Fresno County reported 167 incidents of elder abuse in 2017 to 18. And the California Department of Justice data indicates that in 2010, Fresno County had a low of 204 crimes, and now in 2016, there was a high of 285 cases. So we're seeing, unfortunately, an increase in elder abuse cases in this county. Two main reasons why Fresno County is seen to be of higher risk for elder abuse are that, one, we have higher than the state average rates of poverty we have 21%, whereas the state average was 19%. And then number 2, higher unemployment rates. We have 8.9%, while the state average is 4.4%. And as we've learned in the course this semester, low SES can be an extreme contributing factor to issues such as elder abuse. This is no exception. Also, California is going to see an 166% increase in the population of older adults between 2010 and 2060. Fresno County will see a 170% increase, so that's even higher than the expected state increase. So that will also lead consequently to more elder abuse cases. A couple of local resources include Adult Protective Services, that's for older and dependent adults, law enforcement, obviously, and long-term care ombudsman programs. Long-term care ombudsman programs are advocates for any older or dependent adults residing in a long-term care facility. So let's look at law and policy now. The law that I chose to focus on was the Older Americans Act. This was passed in Congress in 1965 originally. And the Administration for Community Living, which upholds this act, states that the original legislation established authority for grants to states for community planning and social services, research and development projects, and personnel training in the field of aging. The law also established the Administration on Aging to administer the newly created grant programs and to serve as the federal focal point on matters concerning older persons. And there was a meaningful update in 2016, so very recent, that includes provisions to aim to protect vulnerable elders by strengthening the long-term care ombudsman program and elder abuse screening and prevention efforts. It also promotes the delivery of evidence-based programs such as fall prevention and chronic disease self-management programs. So the Older Americans Act relates to the issue of elder abuse in that it established the long-term care ombudsman program. That is the big score that we got from the Older Americans Act, because this really helps advocate for people who may not have the ability to advocate themselves, which really helps reduce or at least address cases of institutional elder abuse. The problem is that the ombudsman program does not function in domestic cases. So we really need to work to find ways to prevent domestic cases of elder abuse. So finally, I'm going to look at how another country has addressed elder abuse. So I found some information about Ireland's elder abuse addressing system. So they've actually done a lot less than the United States to address elder abuse. According to a review of Ireland's response to elder abuse, the recent policy, so they have had some policies, but the recent policy focus on safeguarding older adults is a positive step forward. For example, the development of the Health Service Executive Elder Abuse Service. However, statutory recognition of elder abuse and increased penalties for those who abuse older adults would promote this further and challenge these inherent attitudes. Unlike other jurisdictions, the provision of additional or special legal protection for older vulnerable adults does not exist in Ireland. So in the US, we do have increased penalties for elder abuse and a increasingly clear legal definition of what elder abuse is. In Ireland, they don't have that definition, and there's no increased punishment for abusing elders who are a lot more vulnerable than, say, a 20 or 30-year-old person. I mean, abuse is wrong in all cases, but especially because older adults cannot defend themselves, the increased punishment really helps deter people from that. But just because we've done a better job at addressing elder abuse in Ireland does not mean that we should fall into complacency. There's still a lot more that can be done here, especially with regards to finding ways to increase the reporting of elder abuse cases. Older adults should not have to suffer in silence, and it's our responsibility to find ways to stand up for those who, in some cases, are unable to stand up for themselves. And here is my references. Thank you.